Acute coronary syndrome. Acute coronary syndrome, or ACS, is a term used to describe a range of urgent heart conditions caused by sudden reduced blood flow to the heart. These conditions include heart attacks, also called myocardial infarctions, and unstable angina, a form of chest pain that signals an increased risk of heart attack. ACS occurs when the blood supply to part of the heart muscle is suddenly blocked, usually due to a ruptured plaque and clot formation inside a coronary artery. When blood flow is blocked completely, heart tissue begins to die. This is a heart attack. If blood flow is only partially reduced, it can result in unstable angina, painful but not yet resulting in tissue death. Other cardiac causes of chest pain. Dissecting aortic aneurysm. An aortic aneurysm is a swelling or bulging at any point along the aorta. The types of aortic aneurysm are defined according to where they occur. The most common place is in the abdomen, called an abdominal aortic aneurysm, or AAA for short. Less frequently, an aneurysm can occur in the chest and is called a thoracic aortic aneurysm, or TAA for short. Pericarditis feels sharp or stabbing, spreads to your shoulders, arms or tummy. Gets worse when you breathe in deeply, swallow, cough or lie down, especially when you lie down on your left side. Gets better when you lean forward. You may also feel hot and shivery, or have a high temperature, cough or painful joints. If you get pericarditis, it often follows a viral infection like a cold or flu. Heart failure means that the heart is unable to pump blood around the body properly. It usually happens because the heart has become too weak or stiff. Arrhythmias are when your heart beats too quickly or too slowly, or your heartbeat is not steady. ACS symptoms: crushing chest pain, severe aching pain, pressure, heaviness or tightness. Radiating pain to arms, usually the left, jaw, neck, back or stomach. Shortness of breath, sweating, nausea, vomiting. Lightheadedness or dizziness, a feeling of impending doom or anxiety. Some people may experience atypical symptoms, especially women, older adults, and people with diabetes. They may feel fatigue, breathlessness, or jaw pain without chest pain. Important clinical questions. When did the chest pain start? What were you doing when the pain started? How would you describe the pain? Is it crushing, heavy, or a tight band? Does the pain radiate to the arm, neck, jaw, or back? At the start of the chest pain, did you feel clammy, sweaty, nauseous, or did you vomit? What other health conditions do you have? What medications are you on? If ACS is suspected, arrange for immediate ambulance response and follow clinical protocols for GTN and aspirin administration. Risk factors for ACS: older age, high blood pressure and cholesterol, smoking, diabetes, obesity or lack of physical activity, family history of heart disease, history of preeclampsia or gestational diabetes, early menopause. Also, rare genetic conditions like Ehlers-Danlos syndrome, EDS, can affect heart and blood vessel integrity. Cardiac valvular EDS affects heart valves, leading to issues like high blood pressure. Vascular EDS involves fragile arteries that may rupture spontaneously. Marfan syndrome is an inherited condition that prevents connective tissue from developing normally. Weakened or damaged connective tissue can affect many parts of the body, especially the heart. The disorder may cause the aorta to widen. It can also affect the heart valves. The most common heart conditions Marfan syndrome causes are aortic aneurysm and aortic dilation. Non-cardiac causes of chest pain. Pulmonary causes: pulmonary embolism, pneumothorax, pneumonia, asthma. Gastrointestinal causes: acute pancreatitis, sudden severe central abdominal pain radiating to the chest, feeling or being sick, a high temperature of 38°C or more, esophageal rupture, severe pain after vomiting or procedure, GERD or peptic ulcers, burning chest pain especially after meals, acute cholecystitis, sudden sharp pain in the upper right-hand side of the abdomen. This pain spreads towards the right shoulder. The affected part of the stomach is usually very tender, and breathing deeply can make the pain worse. Unlike other types of abdominal pain, the pain of acute cholecystitis is usually persistent and does not go away within a few hours. Musculoskeletal causes: rib fracture or costochondritis, sharp pain worsened by movement or touch. Spinal disorders: neck or back issues radiating pain to chest. Fibromyalgia, widespread pain, increased sensitivity to pain, muscle stiffness, difficulty getting to sleep or staying asleep, fatigue, problems with mental processes known as fibrofog, such as difficulty concentrating or remembering things, headaches, irritable bowel syndrome, IBS, feelings of frustration, worry or low mood. Other causes: herpes zoster, shingles, burning pain followed by rash, psychogenic chest pain, anxiety or panic attacks. Acute coronary syndrome is a medical emergency. Recognizing the warning signs, acting quickly can be life-saving.